Alabama loves football. We know this. And unfortunately, for those who do love attending sporting events, COVID-19 will also be there. This is concerning to one UAB epidemiologist, especially if people act like we are not in the middle of a pandemic. Our Nixon Norman has more.
Football is back. This is great news for fans, but for one UAB epidemiologist, not so much.
It concerns me, I'll be honest, for a couple of reasons. Those seats are very close together. They're designed to get as many people in as possible so that the home team can have a big advantage as people are yelling and screaming.
Lack of social distancing and the absence of masks can also be dangerous.
The second thing is people are yelling and screaming. That's what you do at a football game. You're excited for your team. Well, that yelling and screaming allows particles to leave the body, those COVID particles, if someone is infectious, and they wind up on other people.
People have not been able to live their life due to the pandemic for a while now. So much so that missing a game because you have a sore throat is not an option.
Is if you've got football tickets to a game and you've been waiting 3 weeks, 6 weeks, 2 years to go to a football game, if you're feeling a little sick, some people will still choose to go to the game because they don't want to miss it.
So, no social distancing, no masks, and a whole lot of people.
You take all three of those things together, and it's really the perfect storm for spreading COVID right now.
Who's going to these games also plays a part. Younger people are unvaccinated, younger people are getting sick, and younger people will be going to these games.
They're particularly high in children and people between the ages of 20 and 40. And those are the folks that might be at the games. So it definitely is something that worries me. I think that if people are willing, wearing a mask would be such a huge advantage at those football games. Not all season. We're just talking about right now when COVID is at the point that it's at the peak. It's very high, and it could continue to go higher if we don't make some changes in the next 2 or 3 weeks.
Nixon Norman, Fox 54 News.